What is Hodgkin's lymphoma? This is a question that has puzzled many, from seasoned medical professionals to curious students of medicine. To answer it, we need to dive into the fascinating world of cells, tissues, and the human immune system. Hodgkin's lymphoma, named after the English physician Thomas Hodgkin, is a type of cancer that starts in the white blood cells, specifically the lymphocytes. These cells are an integral part of our immune system, playing a pivotal role in defending our bodies against diseases and infections. But what happens when these guardians turn against us? The exact cause of Hodgkin's lymphoma remains unknown. However, researchers propose that it might result from a genetic mutation or an infection. Certain factors, such as a family history of the disease, a weakened immune system, or previous exposure to certain viruses like Epstein-Barr, can increase the risk of developing Hodgkin's lymphoma. Now, let's talk about the symptoms. Often, the first sign of Hodgkin's lymphoma is a painless swelling in the lymph nodes in the neck, armpit, or groin. Other symptoms may include persistent fatigue, fever, night sweats, unexplained weight loss, and an increased sensitivity to alcohol or pain in the lymph nodes after consuming alcohol. Diagnosing Hodgkin's lymphoma begins with a thorough physical examination, followed by blood tests and imaging tests like X-rays or CT scans. If these tests indicate Hodgkin's lymphoma, a biopsy of the affected lymph nodes is performed to confirm the diagnosis. This involves removing a small piece of lymphatic tissue for examination under a microscope. Once diagnosed, the treatment for Hodgkin's lymphoma is determined by the stage of the disease, the size and location of the tumor, the patient's overall health, and their age. Treatment options may include chemotherapy, radiation therapy, stem cell transplant, or immunotherapy. Chemotherapy involves the use of drugs to kill cancer cells, while radiation therapy uses high-energy beams to eliminate them. In some cases, a stem cell transplant might be necessary to replace diseased bone marrow with healthy stem cells that can produce new blood cells. Immunotherapy, on the other hand, helps enhance the body's natural defenses to fight cancer. In summary, Hodgkin's lymphoma is a type of cancer that affects the lymphocytes, a type of white blood cell. The exact cause is unknown, but certain risk factors can increase the likelihood of developing the disease. Symptoms often include painless swelling in the lymph nodes and unexplained fatigue. Diagnosis usually involves a series of tests, including a biopsy. Treatment options vary depending on several factors but may include chemotherapy, radiation therapy, stem cell transplant, or immunotherapy. Understanding Hodgkin's lymphoma is vital for early detection and effective treatment. As we continue to learn more about this complex disease, we hope to improve the outcomes for those affected and ultimately find a cure. So the next time someone asks, "What is Hodgkin's lymphoma?" you'll be ready with an answer.